Welcome back to another episode of Quick Hits. I'm your host, Ken Booth. Now, today's conversation is a special one for me because not only do we have an incredible guest in the world of healthcare IT, but she also lives in my hometown of Omaha, Nebraska. And yes, for those keeping score, that makes two Husker fans on the podcast today. We're thrilled to be joined by Amber Schuetz, Director of Clinical Systems at Boys Town National Research Hospital. Amber has had such an inspiring journey, starting her career as a registered nurse, moving into healthcare IT, and now leading clinical systems for an organization that's making a profound impact in pediatric care. In this episode, you'll hear Amber's story, from navigating stretch assignments early in her career to leading a smooth Epic go-live at Boys Town, and even presenting at Epic's XGM conference. She also shares how her team is embracing AI to transform the patient experience and strengthen connections between providers and families. We can't wait for you to hear this one, so let's jump in. Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler Smith. Tyler, how are you?
Great, Ken. Excited to be here.
Yeah, absolutely. Same here. We're talking to Amber Schuetz. She's the Director of Clinical Systems at Boys Town National Research Hospital. Amber, welcome to the show.
Thank you so much for having me. This is wonderful.
No, we're really excited to talk to you. You've got a really interesting story that we really just want to help people understand and get to know you a little bit better. So let's start with your story. If you could share a little bit about your journey into healthcare and ultimately what led you to a wonderful institution like Boys Town National Research Hospital.
You bet. So I currently work in IT, but I started out as an RN, and I worked as an RN in a couple of different capacities: hospital, ICU, cardiac rehab, clinic. I did quite a few different things as a nurse. And I think what a lot of people do, maybe even especially women, I took jobs that were most flexible with my kids, with what the ages of my children and what they were going through in their different stages of life. And so thankfully, being an RN, there's just a lot of flexibility to that. And so when my kids were early teens, I found myself going through a very big life change. And that is when I switched from being a bedside nurse to shifting over to the EMR side of things, being a trainer, an informaticist, and then eventually an analyst. So when I graduated from nursing school in the early 90s, if you would have talked about healthcare IT, like it wasn't a thing, right? It was definitely just a kind of a progressive journey from graduating from nursing school, becoming a bedside nurse into EMR IT type work.
That's excellent. And we've talked to so many individuals who have had that clinical background, and that just always seems to give them a unique perspective when they make the move over into IT. So looking back with that in mind, were there any defining moments or experiences that kind of shaped how you approach clinical systems leadership today?
Oh, for sure. So in terms of, clinical systems and leadership, I was working as an analyst for our EMR for a very, very large consulting company that is global. And I was fairly new and trying to just get my bearings on what I was doing because I was used to being, taking care of patients. And now I found myself in this analyst type world. And just kind of faceless is the way I felt. And it ended up that the person who I reported to left the organization and I got a new manager. And that person, she ended up becoming my mentor. And I would say it's because she looked at me with fresh eyes. So we had quite large teams. And she was new, I was new, and she was kind of getting her bearings. And she just saw something in me that I think that I, at the time, did not see myself. And she just had this really big belief in me. And I just remember she continued to give me these stretch assignments that were a bit nerve wracking at the time. When I look back on it, I'm just so grateful and so thankful to her for doing that, because that really helped me in my journey to become better at what I was doing and to grow beyond that. And I just remember at one point she said, well, if you don't have a passport, I need you to get one, because I'm going to send you over to India to lead that team for this new project. And I was like,
Wow.
what?
That's
What?
quite a stretch assignment.
No kidding.
I know. I was like, me? And unfortunately, that kind of plays into that whole imposter syndrome, which I think could probably be a whole podcast topic on its own. You've probably done that. But so when I look back on that, then as a leader today, I lead 4 different teams, and I look at that and I try to emulate what she did as far as being a servant leader, approaching leadership with kindness and compassion, and like I said, opening my eyes to the strengths of all the people around me. And maybe looking at someone and saying, wow, you are really doing a great job at this stuff that really well and you've been doing for years. But what do you think about this? Like, have you thought about trying this new project or this new type of skill? And I hope that then the people on my teams are looking at me in the same way of, oh, she sees something in me that other people have not seen before.
How many people have you sent to India?
Well, I did actually, no one. And I did not end up getting to do that project. The project never happened. Unfortunately, we didn't get the bid on that, but yeah.
But you were ready to go.
I was ready.
Yeah.
You were ready.
I got my passport.
Yeah.
We were making plans, and then the project fell through. So
It's interesting how you talk about like the personal, and how it also has an effect on the professional undertakings. I think it's in Radical Candor by Kim Scott, where she talks about these different seasons of your career, and then also the importance of mentors. So and stretching yourself and having folks that push you. But like, is this a typical day? Or do you wake up and do you start stretching people from the beginning of at the 8 a.m. or 9 a.m. or what's a typical day for you in your role as Director of Clinical Systems, and how does your work connect to that mission?
yeah, so I think one of the number one things that I think about on a daily basis is relationship building. And so I do, I have one-on-ones with my team members, but I also do a lot of one-on-ones with people outside of my team. So I'm in IT clinical systems, but I also do one-on-ones with my other collaborators in IT. People think of IT as being one thing, and it's certainly not. I'm in clinical systems. We have networking, we have desktop support. There's a lot of different facets of IT. But then I also do a lot of one-on-one meetings and collaboration with our clinical leaders. So our senior director of the clinics and the senior director of inpatient and OR. Our senior director of the ancillary areas, which is, radiology, lab, pharmacy. So I just really believe that relationship building just really ensures that our clinical systems team is aligned with the needs of those people who are directly serving children and families, enhancing that care delivery and operational efficiency. We are 95% pediatric, probably. We do have some adult patients, but we're mainly pediatric. And I just think that, working on that relationship building, plus I do a lot of throughout the day, project meetings to drive progress on our initiatives. stakeholder engagement, getting the diverse voices from all of our different areas, making sure that they're heard so that we can, drive solutions that are practical, inclusive, supportive, to the hospital and all of the clinics. Constantly trying to just be strategic about what we're doing, looking ahead, planning a roadmap with our clinical partners, just so that we can remain as an organization, forward thinking, innovative, and, to some degree, I'm putting out fires.
Sure.
We, our EMR, sometimes it goes down unexpectedly, not often, but it happens. Or maybe the connection to our credit card server gets kind of wonky, or, we're just, quick problem solving, so that we can minimize those disruptions in care and minimize the disruptions in operations. And I know that, when we're looking at putting out fires is unexpected, but you're showing that you can maintain that stability and trust, your responsiveness.
Sure.
To, quick problem solving helps with stability and trust. And then I also like to continue to work outside of my comfort zone. So my boss knows that, if he wants to put me on a meeting about a topic that I really don't know much about, that I'm absolutely willing, and I'll research it, and I'll grow and adapt. And I think that that's just really important. It's essential in a mission-driven organization. You need to stretch your skills, model resilience and commitment, and then when you, like I was mentioning before, stretch assignments, if I'm not willing to do it, how can I ask, people on my team to do it? So if they're seeing me doing it, then they might feel a little bit more comfortable too. So, all of these things on a daily basis are just keeping a finger on the pulse of the needs of those directly serving children, driving progress on initiatives, strategic planning, problem solving, adapting, a whole bit. So.
Yeah, and when you talk about strategy, it kind of begs the question of the broader org. And Ken is also a Nebraskan, so he probably already knows the answer to this question. But yeah, I would love to learn more about Boys Town. From what I understand, you'll have a very unique history. You mentioned mainly pediatrics, but some adults. But if you could give us an overview of the mission of Boys Town and what makes it stand out in the healthcare landscape, whether in Omaha, Nebraska, or just the rest of the country or the world.
I love talking about this, and I certainly am not the best person at telling this story, but I'm going to try my best to really give you good cliff notes on the history of Boys Town.
Excellent.
So I don't know if you've ever heard the phrase, he ain't heavy, father, he's my brother, or he ain't heavy, he's my brother. That came from Boys Town. There's a movie called Boys Town that Spencer Tracy won an Oscar for that in the 1930s or something like that. But
solid movie.
Yes. So Father Flanagan, back in the early 1700s, he was from Ireland, and he came to Omaha, and he was ministering to homeless men. And one of the men, he asked one of the men, having conversations about how can I help you? How can we help prevent this type of thing? And one of the men said, "Where were you when I was 12?" Back then, they would arrest a 9-year-old and put the 9-year-old in jail. I mean, that's just the way, I guess you could even call it the frontier, back in the early 1900s. So that's when he kind of shifted his ministry to children, and he started this Home for Wayward Boys. And what happened was Omaha back then was not very progressive, and the city didn't like it very much that he was ministering to boys that were different cultures, different religions, different races. They did not like that. And so he decided to leave Omaha and he went several miles west, which currently, the current site of Boys Town is kind of in the heart of Omaha now because it's grown so much. But Boys Town then was west, it was out in the country, and they built this tall pillar so that boys that were in downtown Omaha could see it actually, and they could just walk that direction and know that they could get help. It was a long walk, several miles, but they knew that they could get help. And so it evolved into just a really unique model for caring for children with family teacher homes. And so the way Boys Town looks now is Boys Town is a town. We call it a village. It has a post office, has a high school, but it's all Boys Town. It's the hospital and it's the family teacher homes. And so we've got our family teachers live in houses here at Boys Town, and they have boys and girls who live in the homes with them, and they live as a family. So they do homework at the kitchen table, they have their meals together, they go to the high school here at Boys Town, and they get a lot of other resources. And so the high school has football team, basketball team, they've got everything that any other high school would have, just so that we've got, kids who come from troubled backgrounds or have, varying different issues, can have a chance at kind of a nuclear family type of a situation. And so I would really encourage anyone who's interested in this story to go out and take a closer look at what we do. There's so many success stories of kids who they're on the wrong path, that have come to Boys Town and completely changed their lives around. And so then in the 1970s, Boys Town was working with kids who had hearing problems, like audiology type things. And that was kind of the beginning of the Boys Town National Research Hospital. That's when we actually got into the healthcare side of things, right, about 50 years ago. And it just grew into, a hospital. We have our surgery center, we have inpatient units, we have our inpatient unit, our intensive care unit. We also have our IPU, which is the inpatient psychiatric unit, which is acute psychiatric care. And then we have a long-term, it's PRTF is what we call it, or the psychiatric residential treatment facility. And those are for kids who are long-term, not necessarily children from the family teacher homes or the high school students that are here. It could be, but it's, open to the entire community for help if you're just a family who needs help. So it's really a unique model. It's a very unique hospital, and just really very proud to be a part of it.
That's amazing. I was going to ask, dude, what's the current population there?
607.
Okay, oh, that's
It's
great.
it's 1 square mile. Boys Town is 1 square mile.
It always seems bigger, when I was in town. So, I haven't lived in Omaha since 2014, but definitely get a chance to go back frequently because I still have family there. But
Good.
yeah, it's formative years spent in Nebraska. So obviously I became a Husker fan. We'll talk a little bit more later about what we can do to make sure that we eventually get a national championship one of these years.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions.
We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now, back to the show.
Let's move on a little bit. So we talked a little bit about just the unique history of Boys Town and obviously what your focus is. So you're nationally recognized though for your research and the pediatric care. So we want to start talking a little bit about those clinical systems. So they play such a crucial role. Do you have any projects or any examples of something that you're really proud of leading? Any enhancements over the last few years, or even current initiatives?
So we went live on Epic, which is our electronic medical record, in the fall of 2021. And that is where all of my IT experience over the past several years before that was being an Epic trainer, an Epic instructional designer, an Epic analyst. So when we went live here at Boys Town on Epic, I was the training manager. And we are part of a model called Community Connect. So we are hosted by another hospital organization, not directly from Epic. And it just was kind of a unique and challenging situation to train about 1,700 people who needed to have access to Epic. And so I'm especially proud of how our training program was created and developed over that time, because then when it came time for, the day of go live, we only had one person who did not end up being trained, and that's because it was a consultant whose last day was supposed to be the day before, and they decided to extend that person, and we didn't know. And so, if you take that person out of the mix, we were 100% ready with our training program the way it developed. And what ended up happening from there as far as the training is Epic asked me to present at XGM. Epic XGM
Very
is
cool.
every spring.
Yeah.
And so I actually presented in the spring of 2022 at XGM on our training plan. And then after that, I had for about year and a half, I had Epic reaching out to me saying, so-and-so is going, this organization is going to go live on Epic. They need help with training. Can you please reach out to them, help them with, figure out what their plan is going to be. And so I'm just so proud of that we were able to build something that worked so well for Boys Town, but then able to share it at Epic and to share it with other organizations so that they could have smooth go lives as well. Training is historically one of the hardest and most challenging parts of an Epic go live. And so to be able to develop that and have it go smoothly and then help others I'm just happy about that. Very proud of it.
Yeah, no, it's a huge accomplishment, having been a part of many Epic go lives over the years in my days as a ambulatory builder, and then as at Health Data Movers, and we've taken organizations live. So you should have immense pride, and very, very cool that you spoke at XGM about the work that you did.
Thank you.
So while you were at XGM, I'm assuming you probably mingled with some individuals or peers from larger health systems. What are some unique challenges or opportunities that you think that you've faced compared to some of those larger health systems?
Oh, yeah. Great question. The first one that comes to mind would be just probably resource constraints, budget. We're a small nonprofit. And so, we don't have access to all of the resources that a larger health system would have. But I think I would flip it then to talk about the opportunities that we have as opposed to larger health systems, and that would be the deeper relationship building, like I was talking about before, more hands-on support to ensure adoption of our EMR. I got to tell you, Boys Town, I've been a part of a lot of Epic go lives in my past positions. And Boys Town was probably the best organization that I've worked with as far as adoption of a new system. Change is hard. Change is hard, especially for, I would say especially for nurses and doctors. And I can lovingly say that coming from the place of being a nurse, that we don't like to change. And Boys Town, they just were so open and teach me more. It was so good. And I just feel that, being a smaller organization, we can be a little bit more agile. We can connect more closely to our mission. That cross-functional collaboration, is a little bit easier. And then, rolling that all into one just makes it so that we can have a more personalized impact for people.
So then do you think that that's helped you provide better care for patients?
Oh, absolutely. Absolutely. The size of the organization, for sure, being part of clinical systems, but the clinical systems side of IT, I would say clinical systems is just very central to capturing, managing, analyzing patient data. And with the rise of AI, we're, instead of saying, "Oh no, AI, we're scared," we're embracing it, And so these systems are evolving from being, static record keepers to more dynamic decision support tools.
Absolutely.
They help our tools help clinicians make faster, more accurate diagnoses, personalizing treatment plans, helping to predict patient risks, ultimately improving patient outcomes. So Epic is always on the forefront of that technology. And so just embracing that, I think, and having our operational folks embrace that as well. It improves patient outcomes.
Which is a good segue to kind of looking ahead as you talk about AI. And we got to AI, I think, we're almost a half an hour in, so that's pretty impressive.
We did pretty good.
Yeah. So not to lead the witness, but yeah, what does excite you the most as you look forward or focus on the next few years? Whether it's new technologies, data strategies, or initiatives at Boys Town.
Yeah. So we're really taking a hard look at patient experience. So mobile application, patient portal, my chart, things like that, communication platforms, SMS, messaging with patients. Our IT systems are just helping to create more connected, personalized care experience for patients. And they're, most of our patients have a parent or a guardian, or and that presents its own unique challenge. And so if we can stay connected with them and ensuring real-time access to health information, appointment scheduling, fostering that stronger patient and provider relationship, that is exciting to me. Just connecting the patient and the provider using technology.
Sure.
That's pretty exciting. Mm-hmm.
And you most see that manifesting with ambient, or what are the routes that you see that happening?
Yeah, so what we're finding is some of the different technologies that we're able to use, like Copilot, DAX, that generative AI type stuff, so that a provider can sit in a clinic room with a patient and the patient's family and have a conversation, looking at them, having a conversation instead of looking at the computer and typing while the patient is talking. If we are using something like DAX Copilot, the AI is formulating the note instead of the provider writing the note as they're talking to the patient. That just, I think, fosters more trust. And like I said, that relationship with the provider, my provider's really paying attention to me instead of staring at a computer screen, so
Sure.
That's just one of the ways.
I agree. Just when you see that drive to improve patient care, adding on these additional tools. And like you said, Epic really does a great job of kind of presenting the latest and keeping you on the cutting edge if you choose to take advantage of that. So I think that's wonderful. If you could leave our listeners with one piece of advice or even some perspective about the role that clinical systems plays in healthcare's future, what would that be?
Yeah, IT clinical systems, you can think of it as just supporting functions, but it's no longer just supporting functions. It's You could say that we are more strategic enablers of quality, safety, innovation in healthcare. So, thoughtful implementation and governance will really determine how successfully healthcare organizations navigate the future.
Wonderful. No, thank you so much. Kind of a follow up to that, personally, what's exciting you about not just clinical and technology, but then when you add in that additional facet of research, how does that affect you personally, or what drives you to keep those three leveraged or with one another or working together well?
I think that as far as research, the pediatric care, and looking at, new technology, data, things like that, the whole digital transformation that can keep all of those things connected, such as, telehealth platforms, the AI powered diagnostics. I mean, there's just a lot going on with things like Cosmos at Epic that connects providers to and patients to different research studies, difficult diagnoses, things like that. It's all reshaping how care is delivered. And IT clinical systems really is the backbone of those innovations. So collaborating with our other IT partners, ensuring infrastructure readiness, system integration, usability. It just all depends on early, continuous collaboration between the clinical, the research, the hospital, the youth care, the technical, just that collaboration of all of those teams is crucial to the success. And I think at Boys Town, we're doing a very good job of it.
Yeah, no, that's great. Thank you so much for your time, Amber. We really appreciate it and just loved getting to hear about the mission of Boys Town and just wish you guys continued success. And we'd love to have you on again in the future.
Oh, I would love it. Thank you so much for having me. It's been a pleasure.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.